Good afternoon, everyone. A warm welcome to all of you joining us today for another insightful session from our Onus Robotic Hospitals, Hyderabad. Today's webinar, When Youth Meet Stroke, 30s and 40s No Longer Safe, brings to light a growing health concern that affects more young adults than ever before. Stroke is no longer an age-related condition, and awareness truly is the first step to prevention. We are privileged to have with us Dr. Tejaswi Rao, an esteemed interventional neurologist at Onus Robotic Hospitals, who has dedicated her expertise to treating complex neurovascular emergencies and spreading awareness on brain health. Over the next few minutes, why strokes are increasingly affecting people in their 30s and 40s, how to recognize the early warning signs, and the role of timely treatment in preventing long-term disability. Before we begin, a quick note. Please post your questions in the Zoom chat box during the session. We'll take them up in the Q&A segment after the talk. Once again, thank you for being here and taking this important step towards awareness and prevention. So today being World Stroke Day, it's very apt that we have Dr. Tejaswi Rao with us. Now, let's welcome Dr. Tejaswi Rao to begin the session. Please go ahead, Doctor.
Hello, sir. Thank you so much for the warm welcome. So I'm very glad today that I have the opportunity to speak about stroke and topic of stroke on the World Stroke Day. So instead of going through the regular stroke, I wanted to touch on the urgency and the need for the awareness among stroke in youth. So today's topic being why is 30s and 40s no longer safe from stroke. So to begin with, stroke isn't for elderly anymore. Because you can imagine a 38-year-old software engineer, because we have been seeing a lot of news these days that they have no hypertension, no diabetes, perfectly fit, just stress and late nights and skip checkups, and they end up in sudden strokes, whether it is heart or brain. So according to statistics, 1 in every 5 strokes now occur in people around less than 45 years of age. So, what are the common driving factors? Mainly lifestyle, stress, and undiagnosed risk factors, which are not similar to the traditional risk factors in the elderly stroke. So, now the stroke is shifting to younger generation, and we need to talk about it, and it is high time. So, stroke can happen at any age, unlike the regular belief, because you can see in the picture there is pediatric stroke as well. Even in children, we see strokes. Only the awareness about this is very low, which is why I'm here to discuss about this topic. So what exactly is a stroke? So we have already discussed about it. Stroke is nothing but disrupted blood flow to a particular part of the brain. So there are two types. The disruption can happen because of a blockage of a blood supply, blood vessel or an artery. This is common type of a stroke, or spillage of blood and diversion of the blood around that area through the blood vessel bursting, which can cause bleeding in the brain. This is called hemorrhagic stroke. This accounts to around 15% of the strokes. And every minute counts. Time is brain, signifies the fact that brain cells start dying within seconds. Because every minute we have around 1.9 million neuron cell loss. So you can imagine the need and the urgency that a stroke gives, which is why so much of awareness is required. Because even in an hour, the loss of neurons can be 2 million into 60. So this is a picture representing types of stroke, block and spillage. So why the change in profile? Why are the younger people affected now? So usually stroke was supposed to be an aged person, of course, associated with the aging of the arteries. Like we know the main phenomenon of stroke is because of the arteries. So they said it was because of the artery aging and hypertension. But today we are seeing a very new profile in young and busy, stressed professional people. So the top contributing factors in youth are usually uncontrolled stress and sleep deprivation because of the shift workings, sedentary lifestyle, especially software engineers who sit in front of a desktop for hours together, smoking, alcohol, junk food, undiagnosed hypertension and diabetes, because most people will not think that in your 20s and 30s, why should you even get it? So nobody gets checked as well. And unfortunately, post-COVID risk factors has increased the tendency of blood thickening. Also, use of hormonal medications, whether to stop her menses or to cause pregnancy or even replacement hormones, PCOD treatment. There are a lot of hormonal medications in women which have the hypercoagulability as a side effect, which can in turn cause a stroke. Also, family history, genetics, race is also giving us a lot of idea about why there is younger people stroke happening in the world today. We have seen a lot of real stories where I have seen a lot of 35-year-olds, working professionals, parents come in with sudden paralysis or speech loss. Unlike the older generation, usually the dependent population having a stroke, stroke in younger will have a larger and broad spectrum impact, not only physically for the patient, but also emotionally for the family dependent on him, not just his family and kids, but also his parents, and financial impact because this person will be mostly the earning member of the family. So the extra impact, not just the physical disability, is going to be very vast and very debilitating. So how can we protect ourselves, or how can we recognize it faster? So, like all strokes, this does give us some warnings, and we need to recognize it early and act upon it as early as possible. The simple test acronym we use is Be Fast. Loss of balance, visual changes, sudden onset of visual changes, face drooping, arm weakness, and speech abnormalities. Any of these symptoms, if you're noticing it, instead of going for a call to an uncle for an advice, or taking a nap, or massaging that part, or even Google, using Google for symptoms, better to call 911 or 108 and go ahead to evaluate for whether it is a stroke or not. Only relax if it is not a stroke. Until and unless proven that it is not a stroke, you cannot relax and take it easy. So don't wait for them to improve. So this is a picture so that this goes into your head and all these symptoms should come to your mind. This mnemonic should come to your mind as soon as possible. So like we have already discussed, the golden hour, the 4.5 hours benchmark that we have makes the full difference between complete recovery and bedridden for life. Because the clot bursting injection that we give, the thrombolysis, mechanical thrombolysis, can save the brain only within 4.5 hours. So only if you rush to the hospital within the first golden hour is when we can actually help you, evaluate you, and give you the injection required within 4.5 hours of the onset of symptoms. So there is another technique called mechanical thrombectomy, that is manually removing it either through suction or through retraction to restore the blood flow, which also needs earlier the better recovery. The TC scoring also depends on how faster you have reached the hospital. So you have to act fast, because to save your neurons per minute, you have to act fast. So unlike the traditional risk factors like cholesterol, smoking, hypertension, and obesity, today we are seeing the new unique risk factors in young people, which are migraines, oral contraceptive hormones, illicit drug uses, hypercoagulability, genetic profile, race related, genetic risk factors, and pregnancy and postpartum, because the blood flow and the capacity of blood increases to 10 times when it comes to pregnancy and postpartum, especially the first 3 weeks postpartum. Very high risk of mother or maternal strokes during this period. So you should keep this picture in your mind: pregnancy, heart related, and extra stress, hormones, drug use, and medications. So what are the hidden risk factors in the young? So what's shocking is that most of them will have silent risks because they are never checked. So high blood pressure and cholesterol usually undiagnosed in young patients. Diabetes and insulin resistance, it could be a family history, or it could be a PCOD or any hormonal imbalance in women and during pregnant stage. Migraine with aura specifically, or there is something called hemiplegic migraine, which is genetic, where a migraine is associated with temporary hemiplegia, that is temporary paralysis of half of your body. So even though we are not very sure whether it is migraine or not, better to get evaluated. Do not ignore it thinking it is migraine and it will relax, or the power will come back once the migraine is over. And other autoimmune disorders and clotting disorders, increased tendency to clot. especially post-COVID, and sleep apnea. The improper sleep oxygen supply to the brain because of the apnea. Apnea means sudden stoppage of blood oxygen to the brain. So all these things can become very hidden risk factors to the young, and a simple checkup, a regular simple checkup, and suspicion of a possibility of a stroke in you is actually depending only on you, because you know your family, you know your lifestyle, you know your diet. So you should know, are you at risk and is it required to get a health checkup? So how can we prevent it? So for the stroke, treatment is actually never ending, because if you had a stroke once, then you are almost at risk for life. So most of the stroke treatment continues for life. So how can we actually prevent it to not ever have one? Is actually regularly checking your blood sugars and lipids and blood pressure. Also having a check on what you eat, how you sleep, and stay active. 30 minutes of a walk every day should help. Manage your stress, manage your work hours, quit smoking and alcohol, absolutely avoid illicit drug use, and be very careful when you're using hormone replacements, and do talk to your gynec before you take it without any prescription. And in case you have a genetic or family history, anticipate it earlier, because genetic patients usually get it a little before anticipation. We call it anticipation, because if we have in our parents in the ages of 60, we might get it in the ages of 40s and 50s. So you should anticipate it and get it checked even though you have no symptoms. So we do have something called rehabilitation, where we can use the term called neuroplasticity and take advantage of it and train the brain, the rest of the brain, into doing the things or helping the paralyzed part getting back into power. But the sooner the treatment is, the better rehabilitation it can be, and you can maybe live your life without any long lasting disability. So early treatment and early rehab can actually give you a full recovery. So starting from limb physio to chest physio, speech therapy, voice therapy, and occupational therapy to restore your independence, especially in young stroke, and family support is very important for a complete full recovery. And it's a wake up call for a healthier life, because any precautions or preventions you're taking for just brain stroke is by default going to protect you from a lot of other diseases as well. And when do you see a neurologist? First, as soon as you see any of those symptoms from the mnemonic B fast. Also, if it is transient, mini strokes, transient ischemic attacks lasting from few minutes to hours also, even if you are noticing any of those, even if the symptom has resolved after your nap, it should be taken seriously, because this was a warning stroke and you are at a very high risk of a full-blown stroke, that too a bad one, in the next 7 days to next 21 days. So get evaluated based on your profile and your risk factors. You might need a vascular screening, you might need an MRI, a cardiac checkup, or just a blood profile. So prevention is far easier than recovery. So just act upon it. So because stroke doesn't wait for age or time, it strikes in the young, the healthy, and the busy ones. So recognize the early signs. Remember, be fast, act immediately. Every second, every minute matters. Live smart and control your risk factors. Protect your brain, because it's the very essence of who you are, and not just a control of your hand and leg movements. So behind every stroke warrior survivor story that could be ours, let's change the narrative from surprise stroke to preparedness, from fear of stroke to awareness, and from tragedy to recovery. So today on 29th October is a World Stroke Day. Let's be greater than stroke.
Thank you, Dr. Tejaswi, for that eye-opening and informative session. We now move on to our Q&A segment, where we'll take a few questions from our participants. So, Dr. Tejaswi, here's a question we have received. Many young people experience headaches and fatigue. When should they worry? It might be something more serious.
If the headaches are unilateral, migraine, like we say, throbbing, like, pounding kind of a headache, and if you're having aura in terms of nausea, vomiting, or blurring of vision, which happens even before the pain, the headache starts. So if you're having this kind of migraine symptoms, along with fatigue is also one of the auras. If you have these kind of symptoms, that too very frequently, and very high in intensity, very severe in intensity. That is when you should make sure that are you on the right treatment for migraine, or is it only migraine or something else. Unless that is the situation, a migrainer usually knows the pattern of migraine that they are going through. So unless the pattern suddenly changes, there's nothing to worry about. You can follow your regular precautions you're taking for migraine. But if it changes and worsens suddenly, it's high time to get it checked.
Thank you for that answer, doctor. So there are certain concerns within, say, younger patients or even older patients. I mean, are strokes in younger patients easier to treat or recover from compared to the older patients?
Unfortunately, no. They are actually not easier. Opposite to that, they are much tougher to identify the cause because they are very uncommon causes. And to find that particular cause in that particular patient is also a huge task for a neurologist unless they open up about their whole lifestyle and everything. So it's not only not easy, but also it has a very bad prognosis. This prognosis in an elderly stroke is kind of expected because we know what the aging has caused to the brain and the nerves. So we kind of have a predictability when it comes to elderly stroke. But in young stroke, the predictability is very low. That is why these sudden attacks, and that is why sometimes mortality, that is sudden deaths, are also more common when it comes to young strokes without warnings rather than the elderly.
Thank you, doctor. Yeah, I understand that the symptoms or the signs which you see in stroke are very negligible and very hard to understand before they really show up very evidently. So my next question would be, how can bystanders help a stroke patient before reaching the hospital? Because we understand time is very crucial here.
If you're a bystander noticing somebody going through any of these symptoms, first thing would be very difficult to convince that person that this could be a stroke. So I think that is most important, to convince that person to go to the hospital in the first place. If he's helpless, then anyways you are on the right track and you can call your emergency phone number and you can take him to the hospital right away. But in case he is having minimal symptoms, any one of the symptoms, or it is only speech, or it is only the half of the face which is crooked, the smile is crooked. So it is very difficult to convince them in the first place. So that is what you have to work on. Convince them that it must be evaluated and ruled out. Because ruling in is easy, ruling out is more difficult. So that will be the major part that you can play as a bystander. In case he's unconscious and is completely paralyzed on one side, you're anyways bringing the patient to the hospital. Just make sure you make him turn to his left and keep him in that position just to prevent an aspiration and keep his breathing adequate, and not to let whatever he swallowed in the last 1 hour to go and aspirate and cause a heart attack. So that is the simple thing you can do. The rest is anyways should be taken care by the stroke care on wheels. But this is a minimum a bystander should be or could be able to do.
Thank you, doctor. One last question before we let you go. What message would you like to give every young person to take away from today's session?
I would like them to know that stroke is just as common for all ages, just as fever is. So if anybody, any age group can get fever or any infection, so can they get stroke. So being aware of stroke and its risk factors is very important. Today, I'm seeing a lot of people in the developing countries, even in schools, even in primary standard, children are very aware of this mnemonic of be fast and the risk of strokes. I think it is high time that our country also remembers and understands this mnemonic, and it should pop up in your mind within milliseconds if you notice any of these symptoms, because there is no time to even think and ask or even Google the symptoms. So this should pop up right away in your mind in case you notice symptom. And acting upon it is actually motivation that you should get by yourself to understand how serious it is. So motivation and understanding and remembering that this is a brain emergency, the most vital organ of your body. So remember the time is brain. So every time you think of a stroke, a ticking clock should pop up in your mind. That is my take home message for today.
Thank you, doctor. Now, before we close today's session, I'd like to take a moment to sincerely thank Dr. Tejaswi Rao for sharing her valuable knowledge and experience with us. And thank you to all our participants for joining in and making this webinar interactive and meaningful. So stroke can happen to anyone, but with awareness, quick action, and preventive care, we can protect lives and future. So on that note, I'd like to inform all our participants and everyone else that we have started, Onus Robotic Hospitals has started this new initiative called Stroke Care on Wheels. And we would like to, awareness, put out awareness on stroke care and how stroke can be managed by spreading awareness on stroke. Okay, so please take a minute to fill our post-webinar survey that will pop up shortly on your screen after the webinar. Alternatively, you can also fill it from your mailbox where you'll have the link there. Your feedback helps us improve and plan more informative sessions in the future. For more health talks and expert-led webinars, stay connected with Onus Robotic Hospitals, Hyderabad. Thank you once again for being part of this important conversation. So stay happy, stay healthy, and take care. Thank you.